So Eloise was born with a rare brain anomaly called holoprosencephaly. There are different variants of it. She has the most severe form called A lobar. When she was born, we were told that her life expectancy was 6 months or less. That's what we were told again and again and again. And she will be 5 this year, which is just wild. We never dreamed that we would get all of this time with her. You know, her life could be filled with going to the hospital for lab draws, or coming to Easter Seals for therapy appointments, or going to different doctor's offices. But having care at home, she's most comfortable at home. It allows her to be in her environment, in a place she's familiar with, and really just feel like a little girl.
OSF OnCall is our digital health entity that sits within OSF Healthcare, and the vision is to meet patients where they are. So one example of how we're using digital and virtual is really close to my heart. As being a mom, when I was first pregnant, I know that I was super scared, and those visits to my provider seemed really far apart. But we have a program where we're able to really support virtually and digitally 24/7, 365 our pregnant moms. And we're able to augment those visits and be able to provide that care virtually and remotely so that we can really support those working moms, also our rural moms. There's so much shortage out in our rural communities of OB providers, delivery facilities, and so really being able to support them so they don't have to travel is great too.
Healthcare doesn't happen from 9 to 5. A lot of times it happens at midnight or 11 or on Saturday or Sunday, and so through these types of digital means at OSF OnCall, we're available 24/7, 365. Really augmenting the care system that's there today and providing a digital safety net and connecting all of those components for patients whenever they need it.
VortiSense Technologies, we are a hardware AI company that is focused on preventing falls and pressure ulcers for 1.2 million seniors all across US. In the last 2 years, we started providing care for virtual nursing and telehealth for various seniors in their homes and nursing homes. So Peoria uniquely has some good resources because of collaborations with JUMP Simulation Center and OSF OnCall. So JUMP is a true space where we can really test a lot of theories and validate and show this work. And OnCall provides services for over hundreds of thousands of people in the state of Illinois. And with VortiSense, we have technologies that can go into any living room for continuous monitoring of patients. And by using the tech from VortiSense, validating this at JUMP, and OnCall using this to provide services across all the households in US would not be a far-fetched dream.
The healthcare system is constantly evolving and changing, and it's really important for Bradley University and the Department of Nursing to sustain and foster clinical relationships with partners that are staying on top of that. It's really important that we have that relationship so that our nursing students can be at those clinical sites and experience those diverse clinical scenarios and really learn from them and prepare to be nurses in the future. Artificial intelligence continues to take a greater, larger presence in the hospital setting, and what we're seeing more and more is that there are patients in rural areas. There are patients that maybe it's not so easy for them to come in for visits and to be hospitalized. Perhaps their immunity is compromised, and their treatment could be delivered remotely or virtually. So it's really important for our nursing students to be able to understand that they may not always work in the traditional healthcare setting. They may work in a virtual setting that's remote.
So my parents immigrated here 4 years back because we were here and we want them to come and live in Peoria, which is a fun place. So I asked my mom, what is one thing that you see that is different in healthcare in the US compared to India? And she said in India, the physicians actually look at you and talk to you. Here, they look at the computer and they keep typing and they hardly look at you. And all this will change with the advent of AI, through which VortiSense is launching Betsy that automatically documents all the conversations between nurses and physicians and the patients. So it's so easy, you don't have to sit and type and waste time on the computer, but actually interact with the patients. This is what all the physicians and nurses became clinicians for. They want to help people, they want to interact with people, not computers.
Peoria, I think we're very lucky in terms of the kind of clinical capabilities we've been able to build here. We have, world-class innovation happening here. I mean, we've been able to connect with the universities, we've been able to connect with clinicians. We're developing, new companies. We have examples of a new company that was developed by two nurses who worked at St. Francis for many years, partnered at Jump. We built a prototype for them, and it's now a new company that will be here in Peoria. So really fantastic commitment, I think, to that in the future.
Doing things virtually is actually empowering as parents because it helps us use what we already have and learn how to functionally use our space. And we're the ones hands-on doing Eloise's therapy with the guidance of her therapist. And so also allowing us just time to be together and be at home and not always being out doing medical things is really important.
Peoria is amazing. The talent in this city is unparalleled. Bringing that talent together around the greater good for patients has been just amazing for me. I've been here 5 years, and I would have never dreamed that Peoria would have the talent, the capability, the passion, the vision to really be world-class and leading in digital health.